Social Skills Intervention, an evidence-based approach for students with ADHD, by Gracen in the School Psychology Graduate Program at Francis Marion University. Research suggests that more than 50% of students with ADHD demonstrate significant problems with social development. This is manifested in ways such as having low self-esteem, avoiding social situations, resisting school, preferring to play with younger students or hang out with adults, being bullied, and becoming the bully. This statistic and these manifestations is what led me to the overall research question. Would increasing social skills in students with ADHD decrease some of these manifestations and some of the problems that these students have in the school system? The purpose of this study was to examine the effectiveness of an evidence-based intervention in improving social skills among secondary students diagnosed with ADHD. The hypothesis for the study was based on the following. Evidence-based intervention, which would be the social skills training, will increase students with ADHD social skills, which will be demonstrated by a higher standard score post-intervention than the baseline standard score pre-intervention using the Strengths and Difficulties Questionnaire. The intervention was implemented using the Social Skills Activities for Special Children. It's a resource book that provides ready-to-use social skills lessons, including worksheets, and it helps students demonstrate awareness of acceptable social behavior and also develops their proficiency in acquiring social skills. It's organized into these 3 core areas: accepting rules and authority at school, relating to peers, and developing positive social skills. Each lesson places specific skills within the context of real-life situations. Additionally, there's hands-on activities that accompany each lesson. That way the students can discuss and reinforce their skills inside or outside the classroom. The participants that participated in the study consisted of 2 male secondary students between the ages of 13 to 15 years old. The students were classified under IDEA as students with another health impairment due to ADHD, and they received special education services. Additionally, each student had a secondary classification. One student was classified as a student with an emotional disturbance, and the other student was classified as a student with a specific learning disability. The first student was 15 years old, and his race was African American. The second student was 13 years old, and his race was Caucasian. The effects of the social skills training curriculum was measured using the Strengths and Difficulties Questionnaire, pre- and post-intervention. The SDQ is a brief behavior questionnaire that looks at students' emotional symptoms, conduct problems, inattention, hyperactivity, prosocial behaviors, and peer relationships. It also includes an impact supplement, which assesses the student's chronicity, distress, social impairment, and burden to others. The SDQ scores are tallied and they fall into behavior descriptions, such as normal, borderline, or abnormal. For the purposes of this study, only the prosocial scale and the peer problem scale were the areas to focus on for identifying an increase as a result of social skills training. Additionally, the SDQ has different forms, but however, for this current study, only social skills in secondary students were looked at, so only the student forms were used. The design of the study is a repeated measures single subject design to implement an evidence-based intervention to increase social skills for students with ADHD. The independent variable are the participants who receive the social skills training intervention. The dependent variable is the level of social skill proficiency as demonstrated by post-intervention student ratings using the SDQ. The operational definition of the dependent variable are the participant scores on the SDQ post-intervention compared to pre-intervention, which will either prove or disprove the hypothesis. The participants received social skills training using social skills activities for special children over a 6-week period. Sessions were approximately 20 minutes once per week during a non-core class in my office. Materials for the session were pre-scripted and pre-planned and directly pulled from the social skills curriculum. The lessons build on each other and they reinforce previously taught skills. The effects of the social skills training was examined pre-intervention and post-intervention using the SDQ, which was completed by the participants. Looking at the students' pre-intervention scores, Student A's prosocial scale was abnormal. Student B's prosocial scale was also abnormal. Looking at the peer problem scale, Student A had a borderline score, while Student B had a normal score. I can say from knowing these students personally, Student A definitely has more peer problem issues than Student B. So these scores are in the range of what I expected. Looking at the post-intervention scores, Student A's prosocial scale fell in the normal range, and Student B's prosocial scale fell in the normal range. Additionally, Student A's peer problems went from borderline to normal, whereas Student B's peer problems remained the same in the normal range. Here is the visual of the pre and the post-intervention data collected for Student A and Student B. Post-intervention data indicates an overall increase in social skills for each student and a decrease in peer problems for one student. Both participants received higher post-intervention SDQ scores regarding social skills compared to their pre-intervention scores. These findings support the hypothesis that evidence-based intervention would increase students with ADHD's social skills by demonstration of a higher post-intervention score than baseline score on the SDQ. Participants' score fell within the abnormal range regarding their prosocial skills prior to intervention. On the prosocial skills scale, participants demonstrated an increase of at least 2 to 4 points after receiving social skills training for 6 weeks. Why are these findings relevant? 50 to 80% of children experience peer rejection. Peers rate students as having low socioeconomic peer functioning, are frequently disliked by peers, and receive positive recommendations than children without ADHD. Most interventions focus on students' academic and behavior difficulties, which result in negative long-term outcomes. Lower educational attainment, completion of average of 2.5 years less of school than students without ADHD, and approximately 25% of adults with ADHD do not complete high school. I can say from the school system, anytime a social skills concern or anything about social skills comes up with any of our students, it's not really focused upon or it's seen as not that big of an issue. But in reality, social skills affect our children just as much as academic and behavior difficulties. Just like all research, the study had limitations. Participant selection was limited to one population of high school students, and it only included male students. Thus, the participants in the study were not a representative sample of the population of high school students with ADHD. The participants were selected from the high school due to convenience. That's just where my main office ended up being, so it limited the generability of skills to other school settings. Also, the study design was a repeated measures single subject case study, which resulted in limiting generalizability of the outcomes. Future research should expand sample sizes to obtain a representative sample of the population of children with ADHD, including a broader range of children. So maybe looking at all secondary grades, or even looking at elementary school students. And also explore the generalizability of social skills post-intervention and across school settings.